Today, I am interviewing Dr. Fawad Mian, who is a board-certified neurologist. He combines traditional neurology with regenerative and functional medicine, offering advanced treatments in PRP, prolotherapy, and stem cells for pain relief. So, without further ado, here is Dr. Mian. Well, welcome to the program, Dr. Mian. Thank you so much for joining me today.
Thank you for having me on the show today.
So we are going to be talking about regenerative medicine and non-surgical pain relief options.
Yeah.
So we're going to be talking about different demographics. So people that are kind of more high performance athletes, and then also people more middle-aged and older that are just having some chronic aches and pains.
Mm-hmm.
So before we get going, I would like to know a little bit about your background information and how you got into this line of work.
My background is originally a board-certified neurologist, I guess now 15, 16 years ago. So for me, one of the first things I used to see off the bat, when I started, was a lot of pain patients. People, headaches, neck pain, shoulder pain, knee pain, back pain. Inevitably, I would always find patients who actually had injuries to their shoulder and other areas of the body like their knee. And these other respective specialists like orthopedic doctors and pain doctors are sending the patient back to me telling me that this is a neurological issue. And so I'm just kind of scratching my head here a little bit. I mean, there's stuff that's torn inside the knee, stuff that clearly seems to be torn inside the shoulder. I had a patient today actually just exactly like that. And they said, go see the neurologist. And, it's the same kind of thing. I'm I already know that the shoulder is already a major issue for that person. But this is what I was trying to see. And, I was kind of trying to reconcile just giving traditional pain medications and one for different types of pain for with the medications that we use. Sometimes that wasn't enough. Traditional physical therapy, acupuncture, plus or minus, helping people a little bit to people to a certain extent. Around the same time, I started having a lot of my own injuries that just kind of came out of the blue. One of the first thing I had, was actually in the gym. And I had let the weight slip when I was doing some shoulder shrugs, and that's just exercise to try to strengthen the traps. And that actually injured my my AC joint or acromioclavicular joint, or that means basically it's a small little joint that's in front of your shoulder over here. And I was in a lot of pain. I couldn't lift my arm above my head. I couldn't put my arm behind my back. Just a ton of pain. Couldn't sleep on it. Couldn't lift weights, and I exercise a lot, so for me it's really important too as well. I felt miserable, and so the thing that I did was go do what everybody else did, go see the orthopedic surgeon, and that's exactly what I did, because I figured they'd be able to take care of the problem. One of the first things that the surgeon says to me is, well, maybe we can get a surgery out of you. Maybe there's a torn labrum there that I can repair. This isn't exactly the thing that I want to hear. First thing I want to hear when I go see the doctor, let me see if I can just start getting in there and start putting stuff back together. So I wasn't really happy with that. I had gotten the MRI. Thank God there was nothing torn for him to try to repair and sew back. But I did have a lot of arthritis in that small little joint that I mentioned. And his physician assistant injected steroids twice, which ultimately proved to be more of a mistake. When I looked at my joint under the ultrasound, after that, it literally looked like a dog was chewing on a bone. That's how bad it looked from the steroids, because the steroids actually are toxic to things like bone, ligaments, tendons, and all of that. So probably the biggest thing that I want to say is that just because you have an ache and pain, and just because you were told to have surgery, a lot of times, unfortunately, people have the obligatory, you need surgery when they don't really need it. There are options. And so unfortunately, many people don't really realize that these are options for folks. And then they think it's only steroids, drugs, and surgery ultimately, and that's not always the case. So, I would encourage everybody to keep an open mind that this can be a great option for somebody who wants to do things non-surgically and then have that minimized downtime. Combine multiple modalities of treatments, not always just the regenerative treatment. We'll often combine different laser treatments or shockwave treatments, try to help stimulate healing too as well. And so those are regenerative in and of themselves because they're trying to stimulate a healing cascade in folks. They can work on different wavelengths and then certain molecules too as well that can try to help stimulate healing. So that also is a non-invasive way of doing things, but often works pretty well together when you do it in synergy with the regenerative treatments. Because look, at the end of the day, I know you work with orthopedics and all of that or whatnot, but we want to keep things intact as much as we can and do the best we can to maintain those things. And for those people who want to do it that way, like I did, and I've had surgery too, so I've kind of had it both ways, then this could be like a great option for you.